Hey there, everybody, and welcome to today's live webinar on dopamine. So we still have about 15 minutes before we get started, but I was here and some of you were here, so I figured why the heck not start just chatting with people. What questions do you have about dopamine or neurotransmitters? Or at this point, we can just talk about mental health if you want, because no, the webinar hasn't started. So welcome to everybody who's here. I see there's 6 people viewing. If you are a counselor, please consider sharing these webinars and all CEUs with your colleagues. That way we can continue to crank out some content. Welcome back, Alushola. Hey, Lisa, always good to see you. How is it in Baltimore? It is beautiful here in Tennessee today. Hello, Adriana and Angela. Welcome back, Claudia. Hello, Eva. Abir, welcome. Hello, Jyoti. Oh gosh, we have a lot of people here early today. Angela says, I work in addictions recovery. I want practical ways to create natural dopamine in early recovery. Yeah, we'll talk about that some, but it's a great question because for most people who are in early recovery, their dopamine levels are crap. There's just no other way to say it. Post-acute withdrawal sucks. And part of that is because their dopamine receptors have basically been fried, if you want to think about it that way. And there's been remodeling. And it's important for them to recognize that increasing dopamine too much is going to be detrimental to their recovery because it doesn't allow the brain time to remodel. Increasing motivation without increasing dopamine is kind of a quandary. And that's one of the reasons I think a lot of times we say, keep coming back, it works if you work it. We need to try to encourage people to focus on the small steps and the small successes and achievements that they have and reflect on what they're doing. When I used to lead groups in residential, at the end of every group, I would go around the room and I would have everyone tell me what's at least one thing that you got out of today's group that could be useful in your recovery process. The fact of the matter is, in early recovery from addiction, whether it is drug addiction or gambling or sex, the dopaminergic system is on the fritz. And helping people recognize that the world will not always be gray. I had a client one time who just wonderful, wonderful man, had relapsed multiple times. And we were sitting there talking one day and I said, tell me a little bit about what triggers your relapse. And he says to me, the world is just gray. And I was like, okay, tell me a little bit more. And his response was when he was in early recovery. Now, mind you, this man had been using for decades. So it was going to take a while for his brain to really remodel. And he had other trauma and stuff that he was also working on. But when he was in recovery, there were no highs, there were no lows. It was gray. And it was unmotivating because that dopaminergic system was so on the fritz, if you will. And for him, that was one of the things that we worked on, was finding color in the grayness. Yeah, it's going to be a muted hue, but let's look and notice how the hue starts to become sort of unmuted as recovery goes along. And in post-acute withdrawal, recognizing that there are some days that you're going to have color and there are other days that are going to be gray again. And that's the way the body works. That's what happens. Think about when they're doing construction on the roads, wherever you are. And at least in Florida and in Tennessee, it doesn't seem like they ever finish a project all at once. They work on it for a while, then they like disappear for a while and it just sits there, and then they come back and work on it some more. And our brains are kind of the same way. When they're going through that remodeling process in early recovery. And it can get really frustrating because you want the remodeling to take place. You want to feel like, hey, I've got traffic going the right way now. And focusing on those positives is going to be one of the things. The other things that you can do are really reduce stress and that's the big thing that we can do. Reduce stress on the HPA axis, the stress response system, because as people get stressed, it triggers the stress response and cortisol goes high, and we'll talk about it in depth in class today. But until the HPA axis, until the stress response can heal, remember, addiction is a stressor. You're just bombarding the system, which is a stressor. The drugs leave the system, or you quit using, and your body, it's like a shock to your body. It's like, oh my gosh, that was too fast. So in early recovery, the HPA axis is dysfunctional, just like the dopaminergic system, helping people recognize the importance of sleep, helping them recognize the importance of good nutrition, give your body the building blocks to repair itself, helping them recognize the importance of stress management and addressing that stinking thinking, because those resentments, those secrets, those things that they're holding on to are going to add stress, and it's going to prevent that brain from healing and prevent them from actually feeling better. So yeah, that's a really good question, and we can talk more at the end of class too. And I'll be happy to stick around. You all know I like talking about neuropsych and neurotransmitters and all that sort of stuff. But Princess, I am glad that I've been able to be of service. Why would someone be deficient in dopamine naturally? Genetics. Or the loss of dopaminergic neurons from traumatic brain injury, from a variety of things. We see dopaminergic neurons dying in Parkinson's disease. So we do need to certainly consider that some people don't have the same level of dopamine. Thank you for being here, Michael, and you are quite welcome. Hello, Sia. Hello, TJ. I'm glad that you're here. We'll talk some about stimulants today, Princess, but all of the drugs are going to increase or alter the levels of different neurotransmitters, which when your brain is flooded with neurotransmitters, when it's overloaded, it reacts, if you will, by pruning neurons, or if you want to simplify it, by kind of frying the neurons. It's overloading the circuits, and that causes loss of cells. It causes loss of density in the brain that is in large part recoverable when people quit using. But it's important to recognize that the brain of people in active addiction who obviously pass away, and we are able to measure it, compared to the brain of people who were not in active addiction, they're areas of the brain that are much smaller as a result of those neurons dying and parts of the brain dying. But again, we have a process called neurogenesis when the body starts getting healthier that helps rebuild those areas. So all is not lost, but there are a lot of changes that take place. So that's a great question. Welcome, Emmanuel. Hello, Cat Gamester. Welcome. Hi, Richard. Heidi. People with depression or anxiety, how do they increase dopamine outside of an SSRI? Great question, and we're going to talk about that in depth today. I don't want to give away too much. It's important to remember that when we talk about dysfunction in a system, it may be that they're not making enough. It may be that it gets reabsorbed too quickly. It may be that the receptors are not receptive to actually taking the message and passing it down the line. Or it may be that the receptors take the message just fine, thank you, but they don't pass it down. There's a breakdown in that connection that passes it down the line. So there could be a lot of reasons, and increasing dopamine could be a problem. If the receptors aren't working, then that means there's enough dopamine. And if we increase the levels of dopamine, we might see other side effects. We have to remember that as we increase any of the neurotransmitters, it will increase certain others and reduce others. So as we increase dopamine and as we increase serotonin, we're going to see a reduction a lot of times in, and I say a lot of times because there are caveats, in things like GABA, which is our main relaxation neurochemical. So if it's really not that easy to increase dopamine, what we may want to be looking at is, are we trying to increase motivation? Or does the person have severe apathy and low motivation that we need to address? And low motivation can also be the result of too little serotonin or too little norepinephrine. And again, when I say too little, that means somewhere along the way, there's a breakdown in the system and the message is not coming through strong enough and loud enough to do what it needs to do. But that's a great question. Hydration, that's another great one, Lisa. And I actually did an entire video that talked about the importance of hydration. When you're dehydrated, your body, your nervous system can't send signals nearly as effectively. When you're dehydrated, your body recognizes that as a stressor, triggers the HPA axis, prevents the brain from healing because it's worried about fight or flight. It's not worried about remodeling and creating new neurons. Alrighty, it is 11 o'clock, so let's go ahead and see which of these questions that I get answered and in the presentation. And again, I will stick around afterwards for anyone who wants to ask more questions. I'd like to welcome everybody to today's presentation on dopamine. I'm your host, Dr. Dawn-Elise Snipes. Today, we're going to discuss what dopamine is and its function, how it interacts with serotonin, norepinephrine, and GABA, the symptoms of excess and insufficiency, and what people can do to help their body balance dopamine and get it into the right level for them. And I've said this before, I'm going to say it again. It's dangerous to think that we can monkey with the system, that we're just going to randomly increase one neurotransmitter and not affect all of the others. So And we're going to talk about that some today. For example, when we work with people who have psychotic disorders and they take antipsychotics, it acts on some of the dopamine receptors and creates certain side effects that can be problematic. One of those side effects is actually preventing them from getting good sleep. And as a result, there's more stress, and it throws other things like estrogen and testosterone out of whack. So it's interesting how it all works together. And I'm not going to talk about it a whole lot today, but it's important to remember that all of your neurotransmitters, your dopamine, norepinephrine, serotonin, acetylcholine, GABA, glutamate, and there's others, but those are the big 6, interact with cortisol. They interact with your thyroid hormones. They interact with your gonadal hormones, including oxytocin, estrogen, testosterone, progesterone. And if you've been with us through this entire series, you know that each one of those chemicals, if you will, or substances, has dramatic effects on mood. And if one goes wonky and it causes another to go wonky, then you have this cascade effect of wonkiness, if you will. So let's talk about dopamine. Dopamine is a neurotransmitter located throughout the body, including the brain, the immune system, the kidneys, and the pancreas. Just like all of our other neurotransmitters, it's got its grimy little mitts in everything. However, dopamine does not cross the blood-brain barrier, so its synthesis and functions in peripheral areas, which means throughout the rest of the body, are largely independent of its synthesis and functions in the brain. Now, this is unique with dopamine. So that's just a unique thing to recognize. So if somebody takes a dopamine pill, it ain't going to do anything for them. It is dopamine synthesized from L-DOPA, and it's your main motivation chemical. It gives motivation salience to things. When our dopamine is adequate and we do something that's pleasurable, then dopamine helps us process that memory and say, that was awesome, let's do it again. If it was problematic, dopamine says, let's process that memory and not do it again. I'm not going to come back for this one. Dopamine can reduce insulin production and increase food intake, which impacts serotonin levels, which is kind of interesting. When your insulin gets low, your body says, oh, my blood sugar's low, I need to eat. And when people eat, it increases dopamine and serotonin levels. I am not prescribing by any means, randomly self-medicating with food or something else that might increase dopamine. But we have seen that your comfort foods, your high fat, your high sugar processed foods tend to cause a spike, not only in blood sugar, but also in dopamine and serotonin. You have dopamine and serotonin in your gut, where they play a role in digestion. If your peripheral dopamine levels are low, then you're going to have more difficulty with digestion. Dopamine reduces gastrointestinal motility and protects the intestinal mucosa. We talked in the serotonin video about how a lot of the intestinal mucosa is made from 5-HT, which is a precursor to serotonin. But we also have to recognize that there are other things at play. So if the gut is upset, it could be that serotonin's low and that 5-HT barrier is getting too weak. It could be that dopamine is lower and the intestinal mucosa is not being protected as much. Another take home from this is if the gut is upset, it's not absorbing the nutrients. No matter how well you're eating, it's not absorbing the nutrients it needs to make the hormones and neurotransmitters and everything else to heal the body. Dopamine reduces the activity of lymphocytes and reduces inflammation by suppressing pro-inflammatory cytokines. Let's think about this. Dopamine is our motivation chemical. Dopamine spikes when the stress response goes off, fight or flight. And dopamine says, I'm really motivated to protect myself. All right, well, that makes sense. If you're in pain, if you've got a lot of inflammation, you're not nearly as effective at fighting or fleeing. You're in pain. So part of the stress response is a reduction of inflammation. Now, cortisol is the main chemical involved in suppressing inflammation during the fight or flight response. But dopamine does do a little bit too. Mood. Well, dopamine impacts mood. If you're not motivated then to get off the couch, then you're not going to be exposed to anything that might trigger feelings of happiness. It helps with coordination and muscle movements. We see that people with restless leg syndrome have problems with their dopamine. We see people with Parkinson's disease have problems in their dopaminergic system. Generally, when we start seeing muscle tremors and things like that, dopamine is getting too low. When people have psychosis, dopamine is getting too high. What we struggle with sometimes is if you have somebody who has psychotic features with their mental health diagnosis and they develop restless legs or Parkinson's, then you're kind of scratching your head. And I actually did have a client that struggled with that at one point. The antipsychotic medications actually reduced the dopamine too much. But so the doctor really struggled trying to find the right balance of medications. So she didn't have restless legs and she also wasn't actively psychotic. Dopamine impacts learning, attention, and memory. It gets its grimy little mitts into our prefrontal cortex. Motivation. Again, let's think motivation. What's it doing up here? It's motivating you to pay attention to something. And if you're not motivated to pay attention, then you're probably not going to learn very well. Dopamine also, as I mentioned, helps with motivational salience, and it helps filter the things that are important to remember and the things that aren't so important to remember. Regulates the flow of information from other areas of the brain, including problem solving in the frontal lobe and the thalamus. And it also impacts wakefulness. If you've worked with people who are on antipsychotics or have Parkinson's disease, they often are sleepy. And part of this is attributed to people not being able to get good sleep and people not feeling as motivated. They're sleepy all the time. We're going to talk about the sleep issue in a minute. There are many subtypes of receptors for all of your different neurotransmitters. And you can't just say dopamine and where you're talking about everything. Just like you can't say cannabinoid receptors and think you're talking about just one thing. THC acts on one type of cannabinoid receptor. CBD acts on another type of cannabinoid receptor. And these receptors are in different places in the body and brain and serve different functions. Options here. D2 shapes and selects from this initial response set framework. So somebody can think about all the possibilities, but then deciding whether they're going to fight, flee, fawn, freeze, or forget about it is sort of a D2 thing. D1 is the most abundant dopamine receptor in the central nervous system. It regulates neuronal growth and development and mediates some behavioral responses. Stopping right here. Regulating neuronal growth. That's really important in addictions and in other diseases where neurons are actually dying. Neuronal growth, or what we call neurogenesis, is really important. When people's dopamine levels are low, and those D1 receptors aren't getting stimulated, then the brain doesn't know that it needs to build new neurons. An agonist increases and an antagonist decreases. Parkinson's disease medications are dopamine 1 agonists. It increases the activity of the dopaminergic system. Turgoride is an example of a dopamine 1 agonist. It has been used as a treatment for hyperprolactinemia or hypoestrogenism or PCOS, polycystic ovarian syndrome. Why am I bringing that up? Well, you may be working with a client who has low estrogen and they may be developing symptoms of PCOS. It's important to recognize that when the person's level of estrogen is lower than what the body thinks it should be, then you're going to have some side effects. So dopamine agonists can increase dopamine and also increase estrogen levels. It's also used for pulmonary arterial hypertension. Now, this isn't your normal high blood pressure medication. This is specifically in the pulmonary arteries, not as common, but you could see it in a patient. When we take the clinical assessment, we ask about what medications they're on. If you don't know what a medication is, that's fine. Some doctors don't even know all the medications that patients are on that were prescribed by other doctors. You can look it up when they leave, but it's important to understand how medications people are on for different disorders may be impacting their neurotransmitters, their hormones, and their mood and cognition as a result. D1 agonists are serotonin receptor antagonists. All right, remember I've typically said that when serotonin goes up, dopamine goes up. Well, with D1 agonists, we see serotonin being antagonized or reduced. Oh my gosh. So if somebody's taking a D1 agonist for PCOS, then their serotonin may start getting low. That's interesting. 5-HT2A receptor antagonist, 5-HT2A is one of your serotonin receptors, interfere with the heightened state of dopamine activity and may be useful in the treatment of psychosis, alcohol, and cocaine dependence. 5-HT2B antagonists have previously been proposed as treatment for migraine headaches and heart disease. If you've got somebody on migraine medication, it's going to affect their serotonin levels. A 5-HT2B antagonist is going to reduce the activity of the serotonin receptor, but that's also going to act to increase the D1, dopamine 1 receptor activity. So dopamine may increase. And you may be going right now, well, that sounds great. Who doesn't want more dopamine? You don't. Too much dopamine can contribute to ADHD-like symptoms, difficulty concentrating. Remember that Goldilocks principle that we've talked about. Too little is bad. Too much has side effects. You want it to be in that sweet spot. D2 receptors. Schizophrenia can be attributed to an imbalance in dopaminergic pathways that signal D2 and D1 receptors. This is called the dopamine hypothesis. We have found over the years that this is overly simplified. There are other things that are going on in schizophrenia, but we do know that just like in addiction, dopamine does play a role. Most antipsychotics are antagonists, so they reduce the activity of the dopamine 2 receptor. It says, no, we don't need that going on right now. Addictions, any addiction, whether you're talking about sex, drugs, gambling, impacts the D2 receptors more than others. And that's important to recognize because remember, if the D1 receptors are being addressed or whatever, then the D2 receptors may not necessarily be active. Parkinson's disease is characterized by dopaminergic neuronal degeneration especially D2, and requires a dopamine agonist. We want to increase the activity of the dopaminergic system in Parkinson's disease. Since they're losing neurons, then we need to try to increase the activity of that system and like turn up the volume, if you will. D2 receptors are responsible for stimulating dopaminergic transmission in obese individuals and may perpetuate pathological eating as a means to compensate for decreased activation. So what does that mean? That means in people who are obese, who eat for non-hunger related reasons, they may have a dysfunction in their D2 system. Notice I'm not saying just emotional eating. When the body's deficient in D2, it registers that as a problem. It says we're running low, need to do something, which may motivate somebody to eat, because eating, especially those comfort foods, can increase the activity of the dopaminergic system. They may not be feeling emotionally bad. They may be, just literally motivated to eat in order to get those levels up in their brain. Major depressive disorder patients have shown decreased dopamine in the central and basal nuclei of the amygdala. Remember, that's our fear processing of postmortem depressed patients who committed suicide compared with control subjects. So they have less dopamine in their fear processing area, which is, just one of those interesting facts that is out there. It's not something we're going to be able to specifically address and say, well, let's pump up the dopamine in the amygdala. We can't do that with any accuracy right now. Dopamine, depression, and post-acute withdrawal. 2/3 of patients are not achieving remission from depression with current antidepressants. And a lot of patients, and we talked about this before class today, a lot of patients who are in early recovery from addiction, and I use that term loosely to represent the first 2 years for a lot of people, are not going to feel themselves. They're not going to achieve full remission of their mood symptoms with selective serotonin reuptake inhibitors. Because no matter how much you crank up the serotonin, if the dopamine receptors aren't there, no matter how much you crank up the dopamine, it's just got nowhere to go. So recognizing that low dopamine is potentially causative in people with depression and pause, and recognizing what might be causing that for the individual. And we really need to take a close look at the symptoms and not worry so much about the neurotransmitters. I know y'all are here because you're interested in the neurotransmitters, but it's just not that easy. It's not that easy to, there's no pill that we can give somebody that's suddenly going to make them motivated. Anhedonia, or the lack of pleasure, contributes to the persistence of major depressive disorder. Depression and anhedonia have been shown to be associated with reduced dopamine response to reward. Well, that makes sense. If there's half the neurons there for some reason, and I'm overgeneralizing, but if there's fewer neurons, or if the dopamine system isn't being responsive, it's being lazy, then yeah, you're not going to feel very motivated, which, kind of explains it. If the dopamine system is not responding, then the motivation's going to be low. So you may see a reward and be like, yeah, that's cool, but whatever. Most antidepressant treatments do not directly enhance dopamine. We know this, which may contribute to residual symptoms, including impaired motivation, concentration, and pleasure. Now remember, you have your SNDRIs, your selective SSNDRIs, selective serotonin norepinephrine dopamine reuptake inhibitors that people can take. Tricyclic antidepressants and MAOIs, your old-fashioned antidepressants, increase serotonin, norepinephrine, and dopamine, but have significant side effects. In 25 years of practice, I have not worked with someone who was on an MAOI. They're that rare. Now, it could happen, but I wouldn't expect it to happen in clinical practice today. The latest generation of antidepressants, like Wellbutrin or bupropion, can be considered norepinephrine and dopamine reuptake inhibitors. Most doctors are going to start somebody on an SSRI. That's just standard protocol right now. That's what the American Psychiatric Association recommends as the first line pharmacological treatment. But then if they're not responsive to that, they may switch over to an NDRI, norepinephrine dopamine reuptake inhibitor. Let's think about that again. Is this going to work? Is this going to be the magic bullet? No, it's not necessarily. For some people, it'll do wonders. For other people, it's not that they don't have enough norepinephrine or dopamine going into the system. It's not that it doesn't stay there for long enough. It's that the receptors are just not there or they're lazy. So there's a problem later down in the system. And we need to figure out what that is. It's important that we encourage patients when we're working with them, if they're not feeling better, they've been on 3 different antidepressants and they're still not feeling better. Okay, well, let's look at what we're missing. Let's take a look at the broader picture. And one of those broader pictures, as I've been harping on for 2 months now, is going to the doctor and getting a full blood panel, making sure their thyroid, their gonadal hormones are well balanced, and healing that HPA axis, that stress response, because if cortisol is out of whack, then the whole system's going to be out of whack. If estrogen or thyroid hormones are out of whack, the whole system's going to be out of whack. And no amount of SSRIs or SNRIs are really going to impact your thyroid levels. So we need to be cognizant. I worked with one woman, and this is kind of unrelated, but whatever, who was showing signs of severe clinical depression. And one of the first things I do with all of my patients is I say, let's go to the doctor and get a full blood workup done to make sure we're not missing anything physiological, because talk therapy isn't going to fix that. Turns out she was dangerously anemic. They admitted her to the hospital and put her on an IV because she was that anemic. And as soon as they got her iron levels stabilized, she started feeling remarkably better. And that's why I think a multidisciplinary approach is so important. I wouldn't have thought about anemia causing that significant of depression, but it did. Dopamine can decrease inflammation. We talked about that. Dopamine excess may cause vitamin B6 deficiency. Well, how do you get dopamine excess? If it doesn't cross the blood-brain barrier, you may not get dopamine excess in the brain unless you're taking a medication for that. But if you're trying to increase peripheral dopamine, you actually can increase peripheral, in your body dopamine, which can cause a B6 deficiency, which again will impact your body's your nervous system's ability to effectively function. Now, here's an interesting little tidbit. When dopamine interacts with norepinephrine, norepinephrine is inhibited. So when dopamine goes up, norepinephrine is kind of suppressed. And you're thinking, okay, well, that's interesting. And again, this is just in certain areas of the brain. Now, why is that important? Melatonin release is primarily controlled by the suprachiasmatic nucleus, which drives the circadian rhythm of melatonin secretion from the pineal gland. All right, that's not anything that we're surprised by. However, What you may be surprised by is norepinephrine plays a direct role in stimulating melatonin release from the pineal gland. If dopamine's too high and it's suppressing norepinephrine, then guess what? People may not be getting good sleep. High dopamine can impair norepinephrine activity and contribute to insomnia. Both dopamine D1 and D2 receptor mechanisms are important in mediating anxiety. Dopamine antagonists have been reported to be associated with social anxiety disorder symptoms in patients treated for Tourette syndrome and schizophrenia. Okay, well, Patients with social anxiety disorder are commonly given SSRIs. SSRIs are your first line psychopharmacology, psychotherapeutic agent for anxiety and depression. They've been shown to be effective and safe, blah, 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 according to the powers that be. You can argue those points if you want, but that's just what is being published. However, it appears that SSRIs are not effective if the patient is on current dopamine antagonists. So if somebody's on a dopamine antagonist medication, like an antipsychotic, and they're feeling anxious and they're given an SSRI, it actually doesn't do much good. So they're finding there's competition when they're on those medications. We're not prescribers, so you don't need to worry about prescribing. But if you have a patient who is on dopamine antagonists, and they have social anxiety and they're not feeling any better from the SSRI, well, the research says that makes sense. So we may need to look at some other alternatives. We may need to encourage them to advocate for themselves with their physician. Dopamine agonists, things that increase dopamine, can stimulate oxytocin release. All right, so let's go back here for a second. Social anxiety is very common, and if somebody has low levels of dopamine, then SSRIs don't seem to work. All right, that takes us up to dopamine agonists, so let's increase the dopamine. Well, that's not so good if you're working with somebody who has ADHD, Tourette's, or schizophrenia, because we're trying to lower their dopamine. But dopamine agonists can stimulate oxytocin release. All right, so it sounds like that's an impossible quandary. It does, but we may get there. Disruptions in dopamine function can indirectly impact oxytocin pathways involved in disorders like anxiety, autism, addiction, and depression. So, what they figured out is if you can't increase the dopamine because, you're trying to decrease it for other reasons, intranasal oxytocin has actually been shown to be quite effective for addressing a lot of the symptoms, especially related to anxiety and social anxiety, that we see in people who are on dopamine antagonists. Disruption of the dopaminergic system as a result of addiction is also known to markedly reduce oxytocin levels. So dopamine goes down, oxytocin levels go down. Remember, oxytocin is our bonding hormone. Our desire to interact with other people hormone. That goes down. Do I really want to go out and spend time with my friends, or I just want to sit at home and drink? Well, when your oxytocin goes down, that's not a really hard decision. So it's important to recognize that the impaired social emotional functioning in addiction is partly due to reduced oxytocin as a result of the destruction of some of those dopamine neurons. Hallelujah. Oxytocin is also one of those chemicals that is responsible for increasing motivation to interact with others. When you are working with somebody who's in early recovery and they just have no motivation to go to meetings, they don't really want to be around other people, is that low dopamine or is that low oxytocin or both? But those are things that we need to consider. There are ways to increase oxytocin, being around people, doing nice things, intranasal oxytocin. I didn't find any studies that specifically addressed social apathy and intranasal oxytocin in post-acute withdrawal, but it might be something to explore. In terms of PTSD, PTSD messes with your dopamine levels too. Chronic or complex stress can lead to excessive dopamine release initially. And remember, when we talk about combat stress or complex stress disorder or adverse childhood experiences, this chronic stress, initially the stress response dumps dopamine and glutamate and all those other stress chemicals to give you the energy to fight or flee. Makes sense. However, at a certain point, the dopamine levels actually may become depleted. You've secreted so much so quickly that you ran out in the storehouses. Likewise, you may see dysfunction in the system because you secreted so much for so long that those dopamine neurons, just like an addiction, start to become resistant to being activated. They start sort of turning off and in some cases dying off because of overstimulation. And they found that this depletion of dopamine or reduction in dopaminergic activity does contribute to the symptoms of PTSD and CPTSD. Hypodopaminergia, or low dopamine levels, is associated with an increased risk of developing PTSD. And that was actually shown, I talked about it in a couple of videos that I did on PTSD. People who had adverse childhood experiences or complex post-traumatic stress who already had low levels of dopamine were more likely, if they were exposed to another trauma, to develop post-traumatic stress as people compared to people who had adequate levels of dopamine and were exposed to that stressor. So what does this mean in recovery? When we think about addiction, and I know we've got some addiction counselors in here, when you've got somebody in early recovery, they are more susceptible to traumatic injury because their dopaminergic system is not working quite as well. Basically, remember there's that acute stress, the initial stress, whenever that was, whether it was when they were 6 months old or 60, there's that acute stress. The stress response, the HPA axis activates and cortisol is released, your stress hormone, if you will. That increases dopamine and norepinephrine release. Norepinephrine helps you with attention, with focus, with energy, and dopamine helps you with motivation. These are all things we want when we're trying to avoid that hungry lion. With chronic stress, dopamine and norepinephrine, and this is overly simplified, become depleted due to high utilization. And I'm not going to go through it again, but there are multiple ways that dopaminergic system can become inefficient and ineffective. But when that happens, people develop symptoms like depression and anxiety. In other videos, I've talked about the flat to the furious. And when people undergo chronic stress and the stress response remodels like this, when things become miscalibrated, when there's no major stressor going on, they tend to feel apathetic, anhedonic, flat. And when something does trigger them enough to start the stress response, they have this tsunami of stress chemicals that are released, and they become furious or frantic in most cases. Occasionally, you'll have somebody who's so depleted that there's just nothing that's going to get them up off the couch. They're just like, screw it, whatever. And that's a very dangerous place to be when somebody doesn't have the motivation to protect their own survival. Stimulants, whether we're talking Adderall or meth, stimulants increase brain dopamine. Genetic differences that alter the expression of dopamine receptors in the brain, so the way you're wired in utero, can predict whether a person will find stimulants appealing or aversive. Well, score. Technically, there are tests that can be done to see if somebody is going to be more prone to the rewarding effects of stimulants. If you are a parent who has recovered from amphetamine addiction or methamphetamine addiction, and you want to know if your child is susceptible, one aspect of that susceptibility is genetics. Now, remember, it's not all genetics. It's genetics and environment, the whole nature-nurture thing. But there are genetic tests that can be done to determine whether the stimulants will be as rewarding for them as it was for you. Now, remember, even if they don't have that gene mutation or expression, they still may develop an addiction if the environment is bad enough or conducive to developing addiction. But this is one way we can explore. Stimulant users, people who use cocaine, amphetamine, methamphetamine, exhibit lower striatal dopamine D2, D3 receptor availability. Remember, I said there's all kinds of dopamine receptors out there. So they have lower receptor availability. Differences in the D1 receptor were found to modulate responses to opioids. So no matter what's going on with your D2 and your D3, that's not going to impact whether or not you find opioids rewarding or not. But we do know that there are certain expressions or polymorphisms, if you will, of the D1 receptor gene that make opioids way more rewarding to certain people than others. And I think we've all known people who can take pain pills, for example, after they have surgery or something, and they're just like, yeah, whatever, makes me sleepy, could take it or leave it. And then there are other people who take it and it's just like this feeling of elation. And part of that is neurochemical, and it is due to the expression, the way that their D1 receptor genes are expressed. Chronic elevation in dopamine triggers a wide-ranging set of structural changes in the brain that are responsible for the behavioral abnormalities which characterize an addiction. When you use, your brain's flooded with dopamine and serotonin and all kinds of other stuff, cortisol. When those receptors are constantly bombarded and overloaded, your brain says this is not healthy. So it starts shutting down those receptors. It says, no, we're not going to let as much through. And that's what we call tolerance in addiction. And that's, again, due to that chronic elevation of those hormones and neurotransmitters. In terms of structural changes, we see the pruning of neurons. We see shrinking of certain areas of the brain as a result of neuronal death. Dopamine plays a role in depression along with serotonin, norepinephrine, GABA, estrogen, testosterone, progesterone, and oxytocin. We need to remember this. Now, why do I have the plus next to testosterone? To remind myself that when dopamine goes up, testosterone typically goes up. So if dopamine is low, testosterone tends to follow suit. And we have seen in people as they age, testosterone levels tend to drop. Estrogen levels tend to drop. That's just part of aging, which means that it's possible that dopamine levels may also tend to drop some. And remember, dopamine is responsible not just for motivation, but also for learning, for memory, for cognition. And this partly explains why as we get older, those changes in gonadal hormone levels are also impacting our neurotransmitter levels, which make it more difficult for people to think of things, to retrieve memories, to put words together. So older people tend to be slower in responding. Doesn't mean they've got dementia. It just means their brain is slowed down a little bit. The dopaminergic system is modulated by several neurotransmitters, including glutamatergic neurons and GABAergic fibers. Glutamate is our main stimulant chemical. GABA is our main relaxation chemical. GABA is made by breaking down glutamate. So you've got, they're buddies. Changes in the glutamatergic and GABAergic or dopaminergic system influence anxiety-like or depressive behavior. And I'm just kind of driving home that point that if the dopamine system is thrown out of whack, it's going to impact the glutamine and GABA system as well. You can't alter one without altering their buddies. Dopamine dysfunction is linked to certain symptoms of depression, such as low motivation. Serotonin is involved in how you process your emotions, which can affect your overall mood. But remember, dopamine plays on motivational salience. So your overall mood and how you process that emotion is going to inform dopamine about whether this is a good thing or this is a bad thing or it's something to not even pay attention to. Both dopamine and serotonin are involved in sleep, inflammation, appetite, and energy levels. In terms of dopamine insufficiency, and I have direct and indirect, because remember, it could be that there's a dysfunction in the dopamine system somewhere, not making enough, not squirting it out, not leaving it in the synapse long enough, not receiving it, or not sending it. So it could be dopamine, or it could be that some other neurochemical or hormone is too low, which is naturally dragging down dopamine. However, symptoms of dopamine insufficiency include muscle cramps, spasms, tremors, aches and pains, restless legs, ADHD, loss of balance, constipation, difficulty eating and swallowing, weight changes, gastroesophageal reflux, trouble sleeping or disturbed sleep, low energy and inability to focus, moving or speaking more slowly than usual, feeling demotivated, hopeless, inexplicably sad or tearful, mood swings, anxious, suicidal thoughts or self-harm, low sex drive, hallucinations, delusions, lack of insight, loss of coordination, and addiction to particularly stimulants. But in some cases, remember, opioids can also be triggered by the way they act on other dopamine receptors. Now, the things that I have bolded on here, these are all symptoms of depression. And that's why it's so difficult to ferret out which system is malfunctioning. So what do we do to increase it? We're not going to be able to take a pill. Well, there are some medications that actually do increase dopamine, but they are medications. You're not going to find anything over the counter that is going to effectively increase dopamine levels past what your body normally can do. Cocaine and amphetamines, nicotine, stimulants, and MDMA all will increase dopamine levels in the brain. Okay, so we do know that will happen. Like I said, this is not something over the counter. Well, nicotine kind of is, but that's very small in its effect compared to cocaine and ADHD medications, etc. Medications for Parkinson's and restless leg syndrome are designed specifically to increase dopamine. Opioids may increase it. Dopamine reuptake inhibitors, and this is actually another medication that's used for ADHD, methylphenidate. In order to help the body heal, how do we do this naturally? If we're not going to start pumping people full of drugs or encouraging them to talk to their doctor about getting drugs. All right, so what else do we do to help the body balance itself, recalibrate all of its internal machinery? Decrease sugar and caffeine to reduce dopamine flooding. There was a thing for a while, I haven't heard of it much in the past few months, but the dopamine detox. And there's something to be said for this. And I'm not saying you don't want to get rid of all dopamine, but if you are regularly flooding your brain with dopamine, whether you're day trading or you're involved in some high stress occupation or addictions or something else, you're flooding those circuits, and some of them are bound to short out. So the dopamine detox says, let's take a break and quit flooding the circuits and let everything dry out a little bit so we don't overstimulate. And there's something to be said for that. There's something to be said for unplugging, so to speak, and giving the brain a chance to relax. Going along with that is reducing your stimulants, reducing your caffeine and your sugar. That can help. They have found that for people who are trying to reduce sugar and or caffeine, chromium can help with sugar cravings and has been shown to help a little bit with mood in people with depression. Am I prescribing that? Absolutely not. What I'm saying is there are things that patients can talk with a nutritionist or their doctor about to help them get past the sugar cravings. If they're one of those people who just, they're regularly chowing down on Skittles and whatever else, the sugar withdrawals can be pretty poignant because as the sugar detoxes from the body, the dopamine levels are going to go down precipitously, which is going to trigger those sugar cravings. The body says, out of balance. Let's, do what we need to do to increase it again. Get sufficient quality sleep and set your circadian rhythms. And I have like 3 videos on sleep hygiene and the importance of sleep hygiene. When you don't get enough sleep, your body already perceives that as a stressor and triggers the stress response and increases dopamine. When you don't get enough sleep, you have more difficulty, typically, controlling intrusive thoughts, which adds stress, which triggers the stress response, which increases dopamine, which floods the system. When we're sleeping, and especially when we're getting good deep sleep, our brain clears out adenosine. They found that people who are on antipsychotics tend to not actually get nearly as much deep sleep. So when they wake up in the morning, they still have adenosine residue. If you want to think about it as a factory, it's kind of like still having trash all over the aisles in the factory, makes it hard to get around on your day. So a lot of people who are on antipsychotics tend to feel very foggy in the morning because they're not getting that deep sleep. They're also missing out on the time when the body restores and rebalances. But basically, it's important to have people work with their physicians, work with a sleep specialist if needed to get sufficient quality sleep. That's imperative to maintaining balance in the system. Exercise increases hormones that increase dopamine. All right, not everybody wants to go to the gym. I get it. Any kind of exercise, moving your body, gardening, playing tennis, walking the dog, playing with the kids, whatever it is that you like to do that moves your body and increases oxygen. And if it gets you outside and gets some vitamin D, that's a bonus. But that will help increase dopamine. Decrease chronic stress. Chronic stress keeps that HPA axis activated, which eventually will lead to dopamine insufficiency. So decreasing that chronic stress. Have patients make a list of all of their stressors, just everything, and then go through and figure out which stressors they can let go of or they can address to free up energy that they can use to move toward their rich and meaningful life. Some things that we stress over, this chronic stress, is stuff that we don't need to stress over or triggers that we don't need to see. I have all but sworn off social media, and especially the Twitters and the Facebooks and those sorts of things, because I found them to be too triggering. There was just too much vitriol, and it was just nasty, and it would stress me out. I'm like, why are people so ugly to each other? So I quit, and I've had more energy. I've been immensely happier since I did that. But being on social media is not important for me in order to move toward my rich and meaningful life. So that was one of the things on the list that I saw that I said, hey, we can cross this one off. And all of a sudden I had one less stressor. Stress is a part of life. We aren't going to be able to get rid of everything, but helping people figure out, are there things that I'm stressing over or doing that's depleting my energy and stressing my body that I don't need to do? Remember, stress is not just mental, it's physical as well. L-phenylalanine is converted to L-tyrosine, which is converted to L-dopa, which is converted to dopamine. All right, well, great. Thanks for that chemistry lesson. Aspartame. Now, we still have aspartame in a lot of our diet sodas. Aspartame is made by joining together the amino acids aspartic acid and phenylalanine. The consumption of aspartame can elevate the levels of phenylalanine and aspartic acid in the brain, thus inhibiting the synthesis and release of dopamine, norepinephrine, and serotonin. I've talked to a lot of people who drink a lot of diet soda, and when they stop drinking diet soda or they switch to something that's sweetened with something else besides aspartame, they get incredible headaches. And part of this is because of the sudden jolt to the brain of the change in the levels of dopamine, norepinephrine, and serotonin. It goes away, but it's one of those unpleasant sort of detox things. Now, you can increase tyrosine by eating bananas, almonds, apples, watermelons, cherries, yogurt, beans, eggs, and meat. Tyrosine, the amino acid, can cross the blood-brain barrier. If your reason for not having enough dopamine is you're not giving your body the building blocks it needs, well, here you go. Try eating some of these things. You can go online. These are not the only foods that have tyrosine in them. If you don't like any of these, find something you do like. And encourage people to experiment for 2 weeks. Try eating something that's high in tyrosine at each meal and see if they find that it helps their mood. Probably not going to hurt anything. If it doesn't, okay, no harm, no foul, but at least you ruled that out. Adequate levels of vitamin D, magnesium, and omega-3 essential fatty acids may also help to raise dopamine levels. Remember, food is broken down in a chemical process in our body, and in order for that process to take place, and in order for the dopamine to be assembled, if you will, it requires all of these vitamins and minerals and other things to sort of act as spark plugs, if you will. That's why we can't just say, take tyrosine and you're going to be good. The diet needs to be well-rounded, and zinc deficiency is also implicated. Too little zinc may increase dopamine synthesis, but it contributes to ADHD-like symptoms. And zinc is necessary for other activities in the body. Too little, no good. Too much, no good. What's the sweet spot for that particular person? People who drink green tea have been shown to have increased levels of the precursors to dopamine. Ginkgo, SAMe, and ginseng have been implicated or shown to increase the precursors to dopamine. Now remember, a lot of this stuff cannot cross the blood-brain barrier and act on the dopamine in the brain. It may act on the peripheral dopamine, reducing inflammation, those sorts of things. It's also important to recognize that some of these things like SAMe are thought to be, if you will, sort of like herbal antidepressants. What does that mean? That means they will interact with the other medications people are taking. And if somebody has bipolar disorder, taking something like SAMe could potentially trigger a manic episode. So it's really important. Remember, mania is one of the symptoms of too much dopamine. So if somebody has bipolar disorder, they take SAMe for their depression, they may suddenly have too much dopamine and trigger a manic episode. Kava also increases dopamine, which is interesting because a lot of people think of kava as an anti-anxiety medication, or herb, but it is. I mean, they've shown repeatedly that dopamine increases oxytocin, which may help reduce anxiety symptoms. Clary sage, bergamot, lavender, lemon, and rosemary, among others, are essential oils that have been shown in multiple peer-reviewed studies on PubMed to increase levels of dopamine in the body. Now remember, we can't measure the levels of dopamine in the brain in humans because you just can't. The best they can do is measure blood plasma levels, which is your peripheral dopamine levels. Inhalation of essential oils can communicate signals to the olfactory system and stimulate the brain to exert neurotransmitters like serotonin and dopamine to further regulate mood. So the studies mainly looked at what happened in rats because rats' brains are apparently as pretty close to ours, which anyway. So they do know what happens in the rat's brain. And from anecdotal reports with people, it seems like some of these essential oils can be effective at increasing motivation and dopamine levels. How do essential oils actually work? Because that's the question I get a lot. Tiny molecules of essential oils are dissolved in the nose as it stimulates the olfactory receptors, activates its cells that carry signals from the essential oil scent to other areas in your limbic system, in your nervous system. And the limbic system is the primal brain responsible for memory, instinct, and mood, which is why when we smell something, it often triggers memories. It's just going into that limbic system and going, oh, brownies. For me, when I smell pine sol, it reminds me of my grandma's house. It's just one of those almost instant connections. The olfactory system is the only sensory mechanism that involves the limbic system and amygdala in its primary processing pathway, which is interesting. So your sense of smell is the only sensory mechanism that involves the fear processing area and the memory, instinct, and mood area. So when you smell smoke, there might be fire. Symptoms of excess dopamine include tics, addictive, pleasure-focused behaviors. Now, if you don't have enough dopamine, you may engage in addictions, but when you are in addiction, then you typically have excess dopamine when you're using. Hypersexuality, mania, and paranoia are also symptoms of excess dopamine. In people with bipolar disorder, hypersexuality is a very common symptom, sometimes prodromal symptom, to a manic episode. How to decrease dopamine. Most antipsychotic drugs are dopamine antagonists. Okay. Anti-nausea drugs are also dopamine antagonists. Oh, okay. So let's think about that again. You have a patient who is, they get so car sick and they're going on this long trip and they take an anti-nausea drug. Won't call out a name. And when they do, their level of depression and motivation and everything is just, oh my gosh, crap. And I can tell you, it happened for me. And I didn't know why. I would take the anti-nausea medication before we would head into Washington, D.C. when we lived in Virginia. And by the time we would get there, I would just be miserable to be around. And lo and behold, it was monkeying with my dopaminergic system. And, that's probably not a good thing. Helping people understand this. If they have to take the anti-nausea drug, okay, help them recognize that it may also impact their mood, and potentially have them talk with their doctor about if there are other things that they can do to medicate the side effects or to address the nausea. And reduce stress. Going back to anti-nausea drugs, again, generally people take these when they're getting ready to go on vacation. So their loved ones may get really offended if they get to their in-laws' house and the person who took the anti-nausea drugs is just poochy, depressed, unmotivated, blah, blah. So it's important to educate people. And I've gone over my time. I apologize. Dopamine, its function is for pleasure and motivation. Symptoms of excess, psychosis, tics, tremors. Decrease it with antipsychotics, but also reducing stress. Reducing that HPA axis can reduce stress. Symptoms of too little dopamine include depression, Parkinson's, anxiety, and difficulty with problem solving. How do you increase it naturally? Effective diet, especially tyrosine and hydration, exercise, sleep, some essential oils, and norepinephrine dopamine reuptake inhibitors. Alrighty. Well, thank you all for being patient with me. I'm sorry I got off on a little bit of a tangent and ran over my time. What questions do you have about dopamine? And I know there were a bunch of questions. I'm going to kind of scan through here real quick. I know Adriana was trying to address them as much as possible. Thank you, Lisa Hazel. You are so kind. Unfortunately, there are no new treatments for methamphetamine right now. Hey, Shyman, it's always good to see you. Pramath, I'm not sure I understand the question. Is dopamine related to crashes? And yes, New Life, low dopamine is a risk factor for PTSD. It won't cause it. It just makes you more prone to develop PTSD symptoms if you're exposed to a trauma. And for those of you who have questions about pause, I do have a video specifically, actually I have a couple of videos specifically on pause or post-acute withdrawal syndrome, because it's important to understand that in post-acute withdrawal, for most people, all of their neurotransmitters are out of balance for them. Their thyroid may be out of balance for them. Their gonadal hormones may be out of balance for them. We also need to consider the impact of, on a different note, the impact of hormones on people who are undergoing gender transition therapy. we need to consider the impact of a lack of hormones on people who are going through andropause or menopause, and how the gonadal hormones impact mood and cognition, and whether that's something that they want to consider talking about with their doctor. Yes, partly mobile phones, partly increase if you're on your mobile phone and you are getting stressed out, that increases dopamine. Or if you're just, just loving it, whatever you're seeing on TikTok or whatever, you're increasing dopamine, which is potentially suppressing norepinephrine, which is suppressing melatonin release. So it's going to keep you awake. Additionally, mobile phones, you put out blue light, which tells the pineal gland it's not time to go to sleep. So putting a sleep filter on your mobile phone can help with that. But most sleep specialists recommend turning off the mobile phone at least an hour before bed. Yes, Therapist Talks. It is definitely possible to get 31 credits in addiction studies. We have over 500 courses at all CEUs. A lot of them, not all of them, are presented from a co-occurring perspective. I do have the entire 400-hour plus curriculum on all CEUs that I use to train people who are wanting to become addiction counselors. So it's definitely, I have at least 400 hours of addiction specific counseling. Alrighty, everybody. Thank you all for being here. I appreciate it, and I will see you next Wednesday.